Hey, I'm Dr. Daniel Roberts here at Southside Animal Hospital, and today we're going to talk about cleaning teeth and what we actually do in a dental clinic. This here is Chloe, and she is my dog, and today we're going to clean her teeth. She has been building up tartar, and she does that quite frequently, but we'll get her breath nice and fresh today and keep her gums good and healthy. First thing we do when we do a dental clinic, we always start off with a complete physical exam, just to make sure that the dogs are healthy, that there isn't going to be any problems that would keep them from having anesthesia. We also encourage you to do preoperative blood work. This helps to check the liver and kidneys to make sure that everything which processes the anesthesia, and make sure that anesthesia will be as safe as possible with them. So we're going to start off with a physical exam on Chloe and check her over, and then we're going to anesthetize her and we'll get started on her dental. Alright, well, we have Chloe under anesthesia, and she's ready for her procedure. And we have to do general anesthesia on our dental patients. Most animals are not going to allow you to properly examine teeth and clean them with them being awake, because it's just strange messing within their mouth. For some animals, too, they're more prone to getting gum disease or having tooth loss than we are in just regular cleaning. So we have to check, with them asleep, we can do those procedures more accurately. So we're going to take a look, and first thing we're going to do in a dental procedure is we're going to examine Chloe's mouth. Now, if you look at these teeth, you'll see all this brown, and that is tartar that is building up on her teeth. So with that, we look and just see kind of what do things look like, and we check the inside and the outside of the teeth. Next thing that we do is we take and we probe around each tooth, see if there are pits under the gums, if fluid starts to flow, and you can see here that her gums bleed a little bit there, so we know that she does have some gum disease there. So we take time and we probe around each tooth on the inside and the outside. And we also check to see if any teeth may be loose, and if they're loose, then they may need to be pulled, and that is something we examine. Also during the procedure, we have one person dedicated to monitoring the anesthesia of the pet while we're here to help ensure their safety while under anesthesia. Alright, so probing the teeth, and when we flip her over, we will check on the other side. But did not have any big pits, so it doesn't look like we're going to have to pull any teeth on Chloe, but we are going to get them clean. So we're going to go ahead and start cleaning them now. Alright, and when we do that, we have a scaler which vibrates the tartar off the teeth. This makes very quick, efficient work, and a lot quicker than hand scaling, so that we can limit your pet's time under anesthesia. Okay, we have got Chloe's teeth all scaled, tartar off. Now what we're doing now is we are polishing each tooth. Well, what this does is it removes little microscopic grooves in the teeth that make it easier to build up tartar. So by removing those, we get less tartar buildup in the future. And it also is a toothpaste that helps remove some bacteria and freshen the breath. We have finished doing Chloe's dental procedure and got her teeth all cleaned and got her breath good and fresh. She is, we're going to begin to wake her up, and in a couple hours she'll be bouncing around like not much has happened. Luckily, we did not have to pull any teeth on her. If we have to pull any teeth, we have special equipment that we can use to help make pulling of teeth easier and to get them out. If we do anything painful to your pet during the dental procedure, such as cleaning under the gum line or having to pull any teeth, We will give them pain control so that they won't hurt for the first 24 hours and pain medicine to go home so that they will not hurt for the next few days. We do have to do any, with Chloe, she had a little bleeding from the gum, so I'm going to end up putting her on some antibiotics so that she does not get any infections on the gum line or anywhere else in her body. If we have to clean up under the gum line or pull teeth, we also like to place those on antibiotics. So she has done real well. We're beginning to wake her up, and in a couple hours she'll be a pretty happy, bouncy girl with fresh breath. And so come visit us at Southside Animal Hospital, where you always have utmost compassion, quality medicine, and exceptional care.